Hello, I'm Dr. Drake Duane, Chairman of the Medical Advisory Board of the National Spasmodic Torticollis Association. Cervical dystonia, also known as spasmodic torticollis, is a neurological disorder which affects the neck muscles, producing an abnormal head position involving patterned, repetitive, or clonic or spasmodic head movements, or tonic, which is sustained abnormal postures of the head. Cervical dystonia, CD or ST, is defined by the direction of head rotation. If the face turns toward the right, it's considered a right rotational or torsional torticollis. Conversely, if the face turns toward the left, it's called a left rotational or torsional torticollis. In addition to neck turning or torticollis, CD, ST may produce neck flexion, which is anterocollis, neck extension, which is retrocollis, head tilt, laterocollis, or lateral shift. CD can be composed of a single abnormal pattern, in which case it's considered a tonic or fixed torticollis. Conversely, an individual may experience a combination of several abnormal involuntary movements. The word torticollis itself simply means twisted neck. The disorder can sometimes be triggered by an injury to the neck, head, or shoulder that's painful, as might occur in a fall or motor vehicle accident. More commonly, the condition appears spontaneously and may be influenced by a complex genetic group of factors.
Hello, my name is Mayank Pathak. I'm a physician at the Parkinson's and Movement Disorders Institute in Orange County, California. I'm going to be speaking to you today about a disorder known as spasmodic torticollis. Another name for spasmodic torticollis is cervical dystonia. Spasmodic torticollis is a neurological disorder in which the head and neck assume an involuntary, abnormal position and are difficult or impossible to bring back to neutral. Normally, the resting position of the head and neck has a neutral set point determined by the brain and the upper portions of the spinal cord. In torticollis, the set point for the resting position becomes changed, causing the head and neck to assume abnormal positions at rest. Abnormal signals from the brain cause an imbalance in the tone of the neck muscles. One or more muscles spasm and become overactive in their contraction, thus increasing their tone and pulling the head out of position. These abnormally contracting muscles will be referred to as the agonists. The exact direction and degree to which the head moves out of position depends on the particular combination of agonists muscles that are contracting in any individual. In some cases, muscles that correspond to the agonists but are located on the opposite side of the neck will begin contracting in an effort to move the head back to a neutral position. Such opposing muscles will be referred to as the antagonists. The tug of war that results between agonists and antagonists can produce a back and forth rocking motion of the head which resembles a tremor. The goals of torticollis treatment are to bring the head position back toward normal and to decrease pain, thereby increasing the patient's functional ability. The principles used to achieve these goals are as follows. Number 1, stretch, relax, and weaken the overactive agonist muscles. Number 2, strengthen the opposing antagonist muscles. Number 3, use adjunctive therapies as appropriate to manage pain. These can include medications, injections, and rehabilitation exercises. In this video, you will be shown techniques which can be performed at home with a minimum of equipment to accomplish these goals. The first step in therapy for spasmodic torticollis is to obtain an accurate diagnosis and evaluation of the condition by a doctor. A doctor can also determine which exercises are safe and appropriate for you to perform. We recommend that before attempting any of the exercises in this video, you obtain a thorough evaluation by a doctor experienced in the treatment of torticollis and permission to engage in stretching, range of motion, and strengthening exercises. Because different torticollis patients have different directions of head deviation and widely varying severity of their conditions, not all of the techniques shown in this video are appropriate for all individuals with torticollis. It is best to ask your doctor or physical therapist if a particular technique is safe and effective for you. All of the exercises shown in this video are to be performed slowly. You should perform all movements in slow motion. If any movement or exercise becomes unusually painful, you should stop and seek further advice from your doctor or physical therapist. We will begin by showing you some simple range of motion exercises or stretches. Exercise 1. This exercise is designed to stretch and relax muscles running down the back of the neck on either side of the neck bones, as well as muscles connecting the neck bones to the shoulder blades. It is performed in a seated position on a chair that allows you to grasp and hold underneath. We will select the left-sided muscles for demonstration. Grasp the handhold with the left hand as shown. Slowly lean your body toward the right side, and at the same time allow your left shoulder to relax and be pulled downward while keeping your grip on the handhold. You may feel a pulling or stretching sensation deep in your shoulder muscles. Next, turn your head 45 degrees toward the right and then tilt your head in a direction away from your left arm. As you do this, feel the stretch in your deep neck and shoulder muscles. Hold this position for 30 seconds. You may feel the sensation of stretch begin to subside. At this point, you may actually be able to stretch a little further. To make the stretch even more effective, reach behind your head with your right hand as shown and gently help pull along the direction of the stretch. Hold this position for another 10 seconds, then slowly release and relax. The entire procedure can be reversed for stretching muscles on the right side of the neck. Exercise 2. This next exercise is intended to provide stretch to one of the major muscles which runs diagonally across the front and side of the neck and has attachments at the collarbone and at the back of the skull. This muscle is known as the Sternocleidomastoid and is one of the muscles most frequently involved in spasmodic torticollis. We will select the left-sided muscle for demonstration. The left sternocleidomastoid's normal action is to rotate the head toward the right and tuck the chin toward the chest. In order to stretch the left sternocleidomastoid, begin in a seated position. Now slowly rotate your head toward the left side, the side being stretched. Once your head has been rotated as far as it can comfortably go, begin tilting your head backwards so that your chin moves toward the ceiling. Tilt your head to the right and slightly backwards. Adjust the position until you feel a stretching sensation from your left collarbone to the side of your neck. This may require some adjustment and practice. Hold at the point you feel stretch but not unusual pain. After 30 seconds, the feeling of stretch may begin to subside. At this point, you may increase the stretch a little further by cupping the fingers of your right hand around your chin and slowly and gently pushing upwards. As always, stop if you feel pain. Hold this position for 10 more seconds, then slowly release and relax. This entire procedure can be reversed for stretching the right sternocleidomastoid. Exercise 3. The next exercise is a simple alternative stretch for the sternocleidomastoids that stretches both sides at once. This is best done in a seated position in a chair with some support for the back. Simply grasp a handhold underneath you with both hands as shown. Slowly lean your body backward to pull down your shoulders. Allow your shoulder muscles to relax, pulling down your collarbones. Keep your head in the neutral position facing directly ahead. Slowly tilt your head backward so that your chin moves toward the ceiling. You should feel a stretching sensation in the front and sides of your neck. Do not hunch up the shoulders. Remember to allow your shoulders to relax and be pulled downward. Hold at the point where you feel stretch but not unusual pain. Hold this position for 30 seconds, then slowly release and relax. Exercise 4. The next exercise is intended to provide stretch for muscles that lift the shoulder upward, mainly the trapezius. This muscle is also frequently involved in spasmodic torticollis. We will select the left-sided muscles for demonstration. Starting from the seated position, grasp a handhold beside you with your left hand. Now slowly lean your body to the right while relaxing your shoulder muscles and allowing your left shoulder to be pulled downward. Now tilt your head directly sideways to the right. You may feel a stretching sensation from the shoulder to the side of the neck. Hold this position for 30 seconds. You may feel the sensation of stretch begin to subside. At this point, you can increase the stretch a little further by placing your right hand over the top of your head and slowly and gently pulling to the right. Stop if you feel any unusual pain. Hold this position for another 10 seconds, then slowly release and relax. Exercise 5. The next exercise is intended to provide stretch to several muscles in the back of the neck, mainly the Splinius capitis. This muscle starts at the neck bones and runs diagonally upwards to the base of the skull. We will select the right-sided Splinius capitis for demonstration. Its action is to pull the head backwards and rotate it slightly to the right side. To stretch the right Splinius capitis, start in the seated or standing position. First, rotate your head toward the left and then tilt your head downward, bringing your chin towards your chest. You may begin to feel a stretching sensation in the back of your neck on one or both sides. Hold this position for 30 seconds and you may feel the stretching sensation begin to subside. At this point, you may increase the stretch a little further by placing your left hand over the top of your head and slowly and gently pulling forward. Stop this action if you feel any unusual pain. Hold this position for another 10 seconds, then slowly release and relax. The entire movement can be reversed for stretching the left side. Strengthening exercises. The next set of exercises you will be shown is designed to strengthen the antagonist muscles. Strengthening these muscles can help to bring your head back to the neutral position. Ask your doctor or physical therapist which of these exercises is appropriate for your particular case of spasmodic torticollis. In order to strengthen any muscle, it is necessary to use that muscle to exert force against a resistance. The resistance can be supplied by gravity, by an opposing push with a hand, or by a suitable soft object against which to push the head. A pillow-sized block of soft to medium foam rubber works the best. This can be obtained from a medical supply store or a pharmacy. Suitable oversized pillows made of foam rubber may also be found in department or bedding stores. Larger sized, thick foam pillows work the best. Most of the following exercises can be modified to be performed in the standing, sitting, or lying down position. Your hand or